The International Alliance for the Prevention of AIDS HIV Prevention Education Program Module 4, Prevention of HIV. Now that we've learned how HIV is transmitted, we can understand how best to prevent it. The two most important things in HIV prevention are testing and treatment. Remember, if we can reach the goals of the 90-90-90-0 initiative, 3/4 of people living with HIV would be virally suppressed and far less likely to transmit HIV. There are 3 ways that HIV medications have been developed to prevent HIV transmission. The first is simply treatment as prevention, or TASP. It means getting people living with HIV into treatment and virally suppressed, because when the virus in the body is virtually undetectable, it is virtually impossible to transmit. Next, we have pre-exposure prophylaxis, or PrEP. PrEP is a daily medication for people that are HIV negative but may be exposed to HIV. Taking PrEP faithfully greatly reduces the chance of transmission in the event of exposure. Finally, there is also post-exposure prophylaxis, or PEP. PEP is a form of HIV medication that can be taken after an exposure to greatly limit the likelihood of transmission. It can be effective within 72 hours, but the sooner it is administered, the more likely it is to work. TASP, PrEP, and PEP are great ways to help prevent the transmission of HIV. The key word there being help. They should not be relied upon as the only means of prevention. By understanding the ways that HIV is transmitted, we can take additional steps to prevent it. When it comes to sexual transmission, we need to remember the ABCs. The A stands for abstinence, which is the only surefire way to prevent sexual transmission of HIV. The B stands for being faithful, and there are several components to this. First, all partners in the relationship are being faithful to the relationship. Also, all partners have been tested for HIV and have discussed openly their status. And if necessary, partners are being faithful to the medication they're on. C represents condoms, which are protective barriers that separate the fluids from the doors. There are both male and female condoms available. What's important is that we are using them correctly. It means we check for damage, follow the instructions. We use them continuously and consistently. That means the whole time, every time. There is no magic bullet when it comes to HIV prevention. No single method works best for everyone, and no one should rely on a single method. It is important that everyone considers carefully which methods work best for them at any time in their lives, and it's also important to reconsider any time their situations may change. When it comes to blood-to-blood transmission, there are 2 simple rules to remember. First, get a new one. A new syringe. Get a new razor. A new needle in the tattoo gun, and for that matter, new ink as well. Now we recognize that's not always possible. So the second, sterilize it. You can sterilize an instrument by boiling it in water for 30 minutes, heating it over a flame until it's red hot, or washing it with soap or bleach and rinsing it thoroughly. This will kill the HIV. In the case of needles, it's important to remember that HIV can stay alive in wet blood inside the needle for up to 4 weeks. When an expecting mother is living with HIV but is unaware of her status, there is a 30% chance that she will pass it on to her baby. If she knows her status, however, and takes steps to prevent it, that number drops to less than 1%. Prevention of mother-to-child transmission is impossible without testing and treatment. During pregnancy, the placenta separates the baby's and the mother's fluids. However, sometimes open wounds or tears can lead to transmission. It is imperative that all mothers are tested and on treatment as early as possible. When the virus is virtually undetectable, it is virtually impossible to transmit. Childbirth is a stressful and traumatic experience for both mother and child. Tiny open wounds on the baby's delicate skin can allow the mother's blood and vaginal fluids to enter. Getting tested and on treatment even just 24 hours before delivery greatly reduces the chance of transmission. If the viral load can't be brought down enough before birth, doctors can perform a cesarean section or C-section, carefully removing the baby from the womb, taking care not to break the skin. While the mouth itself is not a door, when a baby begins to teeth, open wounds appear in the mouth that can allow the mother's breast milk to enter. Once again, if a mother is tested and on treatment, the risk is greatly reduced. And she can also switch to formula when the baby begins to teeth. So let's recap. What is TASP and who is it for? What is the difference between PrEP and PEP? What are the ABCs of sexual transmission? How is blood-to-blood transmission prevented? And what must happen in order to reduce mother-to-child transmission to less than 1%? We have now completed Module 4, the prevention of HIV, and are ready to move on to Module 5, progression of HIV.